Project Access is a doctor-donated program that provides access to health care for those that don't have health insurance. It is not an insurance program, but a program that helps those who don't have any access to insurance. Project Access provides access to health care by connecting clients with primary care physicians and clinics at little or no cost. We have such specialists as neurology, gastrology, cardiology, and ophthalmology. Project Access is eligible for patients that may also need to benefit from medication assistance program. During that program, what we do is we will try to get you medications that are essential prescription medication, long-term medication at no cost. This service is provided by our staff nurse.
I'm a registered nurse working here with Project Access in the medication dispensing department, and what we do is help to acquire medications for the patients who can't afford and don't have their insurance. We start by reviewing the patient's list of medications to determine which one of those will be available with the pharmaceutical company sponsorship. Only medications intended for long-term use and treatment are included. Medications available in a generic form, often referred to as the $4 list, and those intended for short-term use are not sponsored. Each individual's company has its own eligibility requirements, and they must be met with an application and recent proof of income. The medications are dispensed from our office at 90 to 120-day intervals. From the time your application is sent to the pharmaceutical company to the time you get your medicines could take as long as 4 to 6 weeks. It's important that you have samples or an appropriate substitute form of medication from your provider while the application is being processed. These medicines are lifesavers for people with diagnoses such as diabetes, asthma, and high blood pressure. Persons without insurance could face $300 to $500 a month just for one medication.
Dentist Delivering Smiles offers emergent dental care services for those that have no option of any health insurance whatsoever. Those services are for those suffering with dental pain, and what we're able to do is dentists and oral surgeons are volunteering to help patients in our community with the pain and swelling and infection. The treatment may include antibiotics, pain medication, or extraction of decayed and infected teeth. The patients need to come in to Project Access and apply today and receive the service for only a $25 copay for that emergent care of dental care. Project Access tries to schedule dental appointments with dental patients within 1 to 2 days so that the dentist can begin the medication for the infection and the swelling, and then the patients are added to the rotation for available dental appointments. There is often a waiting list for the dental program, so don't waste time, give us a call today. For the diabetic patients, we offer through our diabetic navigation program. We do counseling services, and we have many counselors throughout the community that are willing to help diabetics that their numbers might either be out of control or they're newly diagnosed and need some additional steps to be able to get the disease under control. These services include such as insulin, oral medications, blood glucose testing and supplies, meters, those kinds of things. We will give guidance about testing and meeting the blood sugar and weight management goals. People wanting to apply for the program for assistance must come into Project Access, and our available days to apply for our programs are Tuesdays and Thursdays, and we are open from 9 a.m. to 4 p.m. on those days. We are located in the West Campus of Community Howard Specialty Hospital. Those applying must be 18 years or older and must have these items when they come in to the Project Access office. The items that we require are photo ID or driver's license, birth certificate, proof of Howard County residency. That could be a bill. We prefer a utility bill or a car registration, such as maybe even a lease agreement could be available. The other thing that we require is a federal tax return. If you have not filed a tax return, we have a form here available to state that you did not file your tax return for this particular year if you didn't need to. The other thing is proof of income for your entire household. That means everybody living in the household that is working, that is making any kind of income, we would need that. Such as Social Security, that would be the awards letter that you get once a year, or 4 weeks current consecutive pay stubs, or a printout with the employer's signature on it. People needing to apply for Project Access should come to the office at 829 North Dixon Road, Suite 100, on the west side of Kokomo, just north of the Kmart on the west side. We are located inside the Community Howard Specialty Hospital.